This is Kenya's biggest conversation, and we're now live on KTN Home. Good morning and welcome, KTN Home audience. This is where now the rubber starts meeting the road. Because from this point on, we're going to be discussing what is expected to come out of State House today. The president is going to be meeting with the governors from all the 47 counties. Of course, we expect the meeting to be a virtual meeting. And they will be reviewing countries' preparedness to combat COVID-19. And actually, countries' response. We are no longer at that preparedness point. It's the response of each and every county in combating COVID-19. Let's start with the issue of the medical professionals and what they think about this, okay? So already we've seen, and we expected that this was going to be the case because medical professionals are the ones in the front line, and we have already called them that, our frontline soldiers in the fight against COVID-19. They are most likely to be exposed to the virus because people coming to seek medical assistance and they don't even know whether they have COVID-19 will come into contact with a doctor. And this is why the government was even dedicating a lot of money in the budgetary allocation to secure the medical practitioners by getting them the PPEs. Now, we've seen a lot of conversation, and this conversation has been coming up from all over the country about doctors and nurses and other medical practitioners who are saying, look, we do not have PPEs. We don't have access to the PPEs. How many medical doctors so far have tested positive in the country? 531 medical practitioners have tested positive of COVID-19 in the country. And according to the Clinical Officers Union Secretary General George Gibore, he says 72% performing aerosol generating procedures, and therefore they are exposed. 8 medical practitioners have so far died out of COVID-19.
Something as simple as they don't have N95 masks.
Yeah.
Simple as masks, yeah.
Yes.
And yet, this is a conversation that we've been having. So when we now say that we have opened up the country, now it's a whole country that's dealing with COVID-19, you have to imagine that people are not going to be going to the main level 5 hospital in a county to seek assistance if they feel that they have COVID-related symptoms. They will go to the nearest health facility. A nearest health facility from the ground, if those people do not have PPEs, then you're saying you're exposing the medical practitioners there to COVID.
Right, that's the unfortunate thing. And we saw a report yesterday, on the news, whereby in, some parts that some medical professionals are even being asked to purchase their own PPEs, which is a problem. Because then the question is, of all the donations that were made, if we just want to look the donation way, of all the donations that were made of PPEs, for whom were they? Would you not assume that they then were for medical professionals and practitioners then to don when they were either taking care of those who are suspected to be ill or those who then have already been found to be positive?
Let's even say that those ones are consumables and they're already consumed.
Okay, let's assume that
because it's a one-off. Right?
Okay, let's assume that they're finished, it's done.
It's a single-use PPE.
You must ask yourself, no, I'm talking about the mass number that then should have been dispersed around. Because we saw that initially there was the hue and cry that came from these quarters where they said, you know what, we are downing our tools, not because we're not being paid, but because we don't have protective gear. And we will not be able to put ourselves at risk, our lives at risk, because there's the lack of this provision.
Yep.
So now here we are again, and we have the same professionals, even at some point being asked to buy them. To buy them, then you have to ask yourself, from whom? And this is a public facility of individuals providing a public service. So I think it's I don't know if sad even begins to describe what this looks like. But the truth of the matter is that the people who are being asked to be on the front line are not protected. How are they supposed to work?
Then there's something else. One, they also say that the numbers are really not adequate. And as a result of this, there's something called burnout. They're getting to the point where they cannot actually function in any productive way. Now, we've heard stories, operative word here, stories of how the government has planned to employ X number of health workers.
Been in the process of employing X number of workers. 1 billion shillings out of the universal health coverage
we were told
was going to this, and then we also saw.
So let me ask the question: How many have been employed so far?
How many have been employed so far?
Where have they been deployed?
Each county is employing its own medical workers. How many have they employed? Each of them. To help us unravel this story, let's speak to the Secretary General of the Kenya Medical Practitioners, Pharmacists and Dentists Union, KMPDU, Dr. Mwachonda Chibanzi. Dr. Mwachonda, good morning.
Good morning to you, Eric. How are you?
Salama kabisa. Thank you very much for speaking to us and welcome to the Situation Room.
Thank you too for the opportunity.
So, Doc, we've just done the introduction and said we have our frontline workers are exposed to COVID-19 and the kind of response that your people are, putting out in the frontline. Just paint for us a picture of what's a country like in terms of medical practitioners.
Well, I think the first thing to appreciate is the fact that we have an acute shortage of healthcare workers across in this country, and this is a situation that has been for decades. If you go back as far back as 2007 and studies done up until now, we've never really achieved the requisite number with regards to doctor population ratio and healthcare worker population ratio. So that puts us in a position where COVID-19 happened across the globe and it came to our country. And as a result of that, then what needed to be done was to redistribute the workforce that is already at shortage to try and respond to COVID-19 and also respond to the other normal ailments and diseases that actually present to facilities. So that is where we started from. And from that point then, you get to a point that we see the government, yes, making pledges that they're going to employ more healthcare workers. We've seen all those advertisements done. But unfortunately, 4 months into the pandemic response, we are yet to see any healthcare worker additional deployed to reinforce the workforce that is currently on the ground. And as a result of that, we are also seeing several of our colleagues getting infected and getting exposed every single day, going into isolation and quarantine. As of 22nd of July, which is 5 days ago, we were at 558. And this is almost 4% of the total disease burden in the country. And for every healthcare worker who goes into isolation and quarantine, they leave a gap. It means the ones who remain have to work much more than what they normally do. And all this response then additionally add onto it the issues that we already have with regards to salary delays, with regards to them not promoting the healthcare workers and putting them in their respective job groups. As a result of that, you're already having specialists who are really needed in this response, resigning from public service and just opting to go into private practice where they can actually get their terms and conditions of work and of employment sorted out. So all this paints a very grim picture of how the health workforce is handling this pandemic. And I can assure you that if in the next 2 weeks, and we're already seeing that tussle between the national and county governments, we're already seeing the issue around the division of revenue bill and the Council of Governors coming out saying that they will delay July salaries. I can assure you that in the next 2 weeks, what you're going to see is you're going to see a blow up of the frustration of the healthcare workers, and they will simply just go back home and sit and wait for them, because you cannot be offering your services and the next thing is you're not even assured of, if you get infected, where you're getting treated, because that's another issue. Where you're getting treated. Secondly, is if you die, we've already lost one of our owners as a doctor. We've lost 8 healthcare workers. And 80% of our health workforce is of the young population, which means they have very young families that need to be taken care of. So if you're dying and you're not assured of any compensation, you're not assured that your family will be taken care of, it gets to a point where you basically say, and the only way to protect myself and my family is to just stay home.
Doctor, if I may ask you a question.
Yes.
Is there any... first of all, good morning and thank you for coming.
Morning to you.
Would you say from your knowledge that there is any county in this country that could be said to have at least taken care of their health workers in any appreciable manner?
At this point in time, I wouldn't say yes at all. Because yes, they could have implemented, perhaps let's say that they pay their salaries on time, which is a very basic thing, but majority of counties will always pay their salaries late. With regards to treatment, you'll find that as we speak today, by the way, I know a number of counties that have not remitted that statutory deduction of NHIF. And I know a number of doctors who've had to pay out of pocket because their family members, their children, or they themselves were sick. And as a result of that, the insurance cannot pay for it because the remittance has not been remitted.
I have to ask you, Dr. Chibanzi, at this point, and I'll also say good morning.
Good morning.
Why? Okay, there were certain pronouncements that were made. Insurance was one of the big ones for medical practitioners, especially after the onset of COVID. And then after that, there was the promise that healthcare workers would be hired. Now, obviously, this has not happened because we're here lamenting about this at this point. Has there been any kind of query made in terms of why this has not happened on both counts, on the insurance aspect and as well as the employment or the hiring aspect?
Okay. So I think for us, we've been following this pretty much. And even initially, when the pronouncement was made and the initial meetings were set up, we got invited and we sat in and made very good proposals. But after the proposals, what has happened is that the people who have been tasked to make sure that this actually happens, I'd say slept on the job. And I'm saying this because they took a lackluster approach after that. And that is why we're where we are today. So even as we make inquiries on this matter, I can assure you that those proposals are seated somewhere. Now, as per last week, the discussion that was having is where are we getting the money? So you ask yourself, and that's the point, are we all on the same page with regards to the COVID-19 response? Because as healthcare workers, we are willing to work and make sure that we take care of Kenyans. But the people who are supposed to take care of us are handling things in a non-emergency situation manner.
So basically, they're just blasé. Now, just going back to the issue of the hiring of doctors. I mean, this was announced a long time ago by the president. Budget was already there. It was just, moving budget from one area to another. Parliament already played its part. And counties had already announced the vacancies. The interviews were happening. And I've heard you say that no county so far has hired an extra medical worker.
Yeah, put it that way. And mostly because what happened is that when the pronouncement was made is that the Public Service Commission at national level was tasked to do that. And counties said no, healthcare is devolved. And then we got into that tussle of this is our role, this is our role. And as a result of that push and pull, the tug of war between those two levels of government has resulted to where we are. And at some point, we have to be alive to the fact that also counties, when led to hire, quickly look at your surname. It's about tribalism here. And these are things that we've been painfully going through as healthcare workers ever since devolution began. That if you do not belong to this county, go back to your home county and seek
employment there.
Dr. Chibanzi, I've got to come back to this because I'm looking at a story, and if I look at the date of it specifically, the date is April 2nd, right? Government has begun hiring of 5,000 skilled health workers at county level in a process expected to be completed in the next 7 days. According to the CS Ministry of Health, he had said that counties had submitted their requirements to the national government, and these positions, like Eric said previously, had already been advertised. So level 4 to level 6 hospitals were recruiting at least 1,000 health workers, meaning that they would have an additional 6,000 medical workers in the fight against COVID. Are we saying that absolutely none of this has happened? Because according to them, county commissioners, head teachers of boarding schools, and those in different parts of the country were moved according to population in order to create space, for example, for medical. So that meant that if these spaces were created, then there were individuals then who were working in those spaces. Yeah.
So the reality, and that's the reality, that we as healthcare workers, we know ourselves at work, and you'd actually appreciate that so and so has come as part of the reinforcement. So the reality on the ground is that we are not seeing these additional healthcare workers. So despite, yes, and rightfully so, that all advertisements were done in April, the doctors who went for the interviews in May keep calling me every day. How far are we? Where are we? Have people been hired and perhaps have been left out? And I'm like, no, because even when I follow up, I'm told that, no, we are waiting for the report of the interviews done in May. And now we are in July.
These interviews are being conducted by the county public service boards.
The interviews there were two levels of hiring.
Right.
Counties were allowed to hire the additional staff based on their resources. And then there was the national response to COVID, the ones that were supposed to be brought on board as part of one, the universal health coverage and repurposed for COVID-19. And then secondly, the ones that were 6 months contracts advertised for COVID-19 at national level for distribution across all the 47 counties. And up until now, none is on the ground. That is the reality of the situation.
And there is no end in sight to when this will, I mean, you have no indication at all when you're going to have the extra medical workers.
The best I've gotten so far as of Thursday last week was perhaps this week they will give their reports and consider now the hiring.
Consider the hiring. Okay.
Let me ask you another question, Dr. This one I want your opinion. Huh?
Yes.
Do you think that health should have been devolved?
In the honest opinion, the idea to devolve healthcare was not done in a way that was meant to hamper our health services. But in reality, knowing the country we're in, and seeing how all this has played out, and the fact that now the health of our people in a county is dependent on the political will of one individual who is the governor. So if he gives healthcare priority and decides he wants to fix healthcare for it to work, it will work. But if the governor decides, I do not want health to be as a matter of priority in me, and I'll give you good examples. We've seen the issues in Kirinyaga County, we've seen the issues in Laikipia County, who till date, amidst this pandemic, fired healthcare workers, and they do not want to reinstate them back, despite even courts pronouncing healthcare should not be devolved at this point in time. It should be a central function that is coordinated across all the counties, and especially with regards to human resources for health management, to standardize and to centralize that with regards to terms and conditions of work and honoring agreements signed between the unions in the health sector and the government. That is why...
For us and others, Doctor... sorry, go ahead.
And that is why we say that, one, a Health Services Commission for standardized management across, where we do not have to deal with the tribalism issue, where health workers can work even in the most remote of areas, in Turkana, in Wajir, in the border counties, in Lamu. With that, then, we would have achieved what we want to achieve with regards to healthcare services in this country.
I think it's important, Dr. Chibanzi, to paint a picture of what it would look like if health was not devolved, but it was then directed from a central government. What would it look like, and how would it be different from what we see right now?
Yeah, so one will be easier with regards to implementation of some of the policy directions from the national level of government. We've seen the universal health coverage agenda being set forth, but that agenda is dependent also on the counties, which claim some level of semi-autonomy. And that means that if you're not all in the same page, then you cannot move all the bricks at once. There are obstacles in place. So if we had it at a central level, it means that we are equipping all healthcare facilities with different equipment at the same time. You implement that across board. If you're doing needs assessment for the human resource requirement, you basically look at the resources across the country, look at the gaps, do the budgeting, and get that from the exchequer, and when it comes to hiring, employment, deployment, you basically just move with it. And a good example is the Teacher Service Commission. They hire up to 5,000 teachers a year. In the health sector right now, that is not possible. And that is why you're seeing 3 months down the line, we are still indicating we've done 5,000, but they are not on the ground. And when it regards to issue of equipment and medical supplies, what are the basic medical supplies required in each facility? What are the essential drugs required? So each facility, and you remember before devolution, you used to have what you call facility improvement funds, the FIF fund, and you used to have the board of management in the facilities that would sit, do the needs for the hospital. Whatever revenue generated from the hospital is used directly to improve services in that facility. With the devolved system of governance, what has happened is that health funds go into the county revenue fund, and the governor can decide that 90% or 20% of this will not go to healthcare, take it elsewhere. Which now affects service delivery. So with regards to facilities and how they function, then there's now an obstacle with regards to the resources that are available there. And that is how it will look if we had facilities being able to do the management and ensure that services are improved in the various areas within that catchment area of the hospital, as opposed to now.
We are speaking with Dr. Mwachonda Chibanzi. He is the Secretary General of the Kenya Medical Practitioners, Pharmacists and Dentists Union. We are dedicating the show today to COVID-19 and the country's preparedness and response to COVID-19, the pandemic. The president is meant to have a meeting today with all the 47 governors, and they'll be discussing the response of the government at all levels on what we are doing in COVID-19. But we also want to hear from the people who are our frontline soldiers, and these are the medical practitioners. What is happening on the ground? Dr. Chibanzi is painting a picture for us, telling us what's happening, what's not happening, which is really not a very good picture. But then let's come back and we'll find out what areas are working, what areas are not working. This is the Situation Room. It's Kenya's biggest conversation, broadcasting on Spice FM and KTN Home, broadcasting on Spice FM 94.4 Nairobi, 87.9 in Mombasa, 102.5 in Kisumu, Nakuru 96.0, 96.7 in Eldoret, 90.9 in Nyeri, and Malindi 97.7. We live stream the show as well, www.spicefm.co.ke, as well as on Facebook, YouTube and Twitter, and the account is SpiceFMKE. This morning also, 7 o'clock up to 9 o'clock, we are live on KTN Home, speaking with Dr. Mwachonda Chibanzi. He is the Secretary General of the Kenya Medical Practitioners, Pharmacists and Dentists Union, talking about the frontline workers in this fight against COVID-19. Dr. Chibanzi has already told us, okay, the president announced in April that we're going to recruit new medical workers to help in the fight against COVID in various cadres. None of them has been employed yet. Then there was the issue, and you alluded to this, Dr. on insurance and allowances, because we know that the government already announced that we're going to come up with a package that would at least give you some sort of comfort, and all medical workers working some sort of comfort that their families would be covered, them and their families that get some sort of insurance cover. Has this been actualized?
Yeah. So the issue of insurance, I'd like to say that where we are currently is that, as remember before devolution, we had what you call the NHIF comprehensive cover, civil servants comprehensive cover. That is a quite comprehensive package in regards to treatment of civil servants. Now, as we speak, and that is the starting point, is that only 20 of the 47 counties across the country are basically enrolled in this comprehensive cover scheme. And what has happened is that the remaining 27 have either procured private insurance, which does not offer comprehensive cover for the workers. And with that, then, we have a number of our healthcare workers on insurance, private insurance, that has now indicated that it is actually happening and not paying for COVID-related exposure and treatment for any of the healthcare workers. Yeah. And then we equally have in the counties healthcare workers who have been hired on temporary terms who do not have any form of insurance. Yes, so the directive was set But as we speak, and that's where we are. And I think at some point, the reality is that how we move as a country moving forward with regards to COVID-19 response is purely dependent on the political decisions and choices that our political players make.
Yep.
Because if they do not take us in the right direction with regards to taking care of healthcare workers, then there's nothing we're doing here, because the central core response of COVID-19 is not the beds, is not the equipment, is not the testing, is not the reagents, it is the healthcare workers.
Mm-hmm.
Yeah.
And they're all exposed. 531 of 558 as of 5 days ago, right? The ones that have tested positive to COVID-19. Yeah. Then unfortunately, we've lost 8 healthcare workers so far to COVID. And this exposes what you're saying. I mean, we have people in the front line and they're feeling that they're not protected in terms of PPEs. This is an issue that KMPDU and other unions within the healthcare were raising from the very beginning. How are we doing so far?
Yeah. So with regards to PPEs, I'd start and say that I'd like to appreciate two specific agencies, rather, that have really come in handy here. Mm-hmm. One is the Kenya COVID Fund that was set up. Remember, this is a private and the corporate entity.
It's a Harambe.
Yes.
Where all of us are contributing something.
Precisely, yes. And then secondly is Equity Foundation, Dr. James Mwangi, who out of his own initiative donated over 300 million just to this, to this cause of personal protective equipment. What that has helped us move is that because the COVID Fund and Equity are focused on the designated COVID-19 facilities that are about 72 in the country as per our first distribution to the facilities.
Yeah.
That is the level 3 PPE, that is the full kit PPE. But unfortunately, equally, is that now we are getting sentiments of the Council of Governors and the Ministry of Health to some extent said COVID Fund has distributed PPEs, so that means that role has been taken up. Remember, this was meant to supplement the efforts of the government. Then secondly, where we are and where we have a big problem right now is all other facilities across the country. These ones that require level 2 PPE, that is the N95 mask, surgical mask, surgical gown, and goggles or face shields. Okay. And there's a big problem because we're talking about level 3 facilities, level 2 facilities, level 1 facilities. And remember that at this point, we are at community spread of the disease.
Yep.
And with a big proportion of the community being asymptomatic. So patients present to the facilities with other illnesses or rather other symptoms, but at some point after taking care of the patient, your index of suspicion rises and you're like, let's test for COVID in this patient. And COVID turns positive. The patient has been in the facility for perhaps the last 2 or 3 days. Mission, or the patient came, and because there was no out of the screening, you basically just had your surgical mask on. What has that resulted in? The increasing number of infections across the healthcare workers.
What should happen here? When you talk about the level 2, just for everybody else's understanding, what is a level 2 facility?
So from level 1, we have what we call the community dispensaries. Then level 2, you have the dispensaries and the health centers, which now move into level 3 facilities. And then you have level 4 facilities that are what we now currently see as what used to be district hospitals. Now we're seeing them as county and sub-county hospitals.
Okay.
Then you have the level 5, that is what used to be provincial hospitals that are now also somehow county hospitals. And then you have the level 6, which is our national referral facility. You have Kenyatta University, you have Kenyatta National Hospital, and you have Mwachonda Referral Hospital. So what we call mashinani.
The mashinani facilities are what we're discussing here, where the healthcare worker should be having the basics, what you've just described. So where should these be coming from, and how often should this be replenished at every facility?
Yes. So the PPE is basically, you're looking at the number of healthcare workers in that facility, the requirements per day or per week. So essentially, if you have a stock, you should have a stock for every week to cover the healthcare workers. And at the end of the month, if and this is based on you, because you're also monitoring the use. You need to ensure that there's rational use of PPEs, which is something that healthcare workers are keen on, because we understand it is paramount to our protection. So by the time the month is ending, or every 2 weeks to every end of the month, you should have brought on board more PPEs for the healthcare workers, And that is where we are also seeing that there is some laxity, because the reality, and I speak to my colleagues who keep calling me and keep asking, is that we are being rationed. We are getting one surgical mask for use the entire day. It's not practical for a healthcare worker.
Yeah.
Because you're performing procedures, you at some point need to change and get another one.
It would seem that these are things that are extremely obvious in terms of the operations of some of these things, even something as basic as, changing a mask. So then I have to ask then, who's responsible? Whose responsibility is it for the coordination of all of this to say that, all right, we've sent a number out to facilities and then we need more, or we need an increase? Who's responsible for this?
Yeah, so whoever is responsible is one at the facility level. You have what you call the managers, who now link up with the county and the sub-county teams to ensure that then the county provides resources for that you have procurement coming in, and that process is quite smooth. But there is a problem, because we know that when it comes to procurement in our country, and you're alive to that, is that then certain interests come into play. So the whole process of procurement gets delayed equally. Then secondly, what we are also getting is that because of the procurement interests, we are having substandard PPEs going to healthcare workers. And at this point, I'd also like to say that it's the responsibility of the government to ensure that they put very stringent quality and assurance measures. I mean, we should be seeing now that the locally manufactured PPEs that are standard is from these factories. But we're not seeing that. Because the same people who are manufacturing substandard have political connections that they use to get this to the healthcare workers. And essentially what happens then is that you're not protecting the healthcare worker. You're basically exposing them because you're giving them substandard equipment.
Do you think there's enough? I mean, it's always a question, and the unique position at which you sit in, Dr. Chibanzi, do you think that there's enough? Because it would seem that, government has so many balls in the air at the same time. There's not enough money to get around. Is there enough to be able to give medical professionals, healthcare workers, what they need to be able to fight? Because like you said, without it, in a week or two, you're going to find some people rather stay home than come out to medical facilities and help Kenyans. It's that bad.
So with regards to whether it's enough or not, I think it is possible to put healthcare workers in a position where they feel appreciated and supported. So with N95 masks, which have to be imported, if you are provided, and let me tell you this, in April, when the Senate Ad Hoc Committee on COVID-19 was set up, we did a memorandum and we went and presented. And in that memorandum, we put what was projected personal protective equipment requirements for all healthcare workers. And the figures they looked huge, but it was also the reality, around 8 million. But that was at the point in time where we were importing. The good thing is we have 7 factories now, out of us helping and taking our time to advise and make sure that whatever you're making is quality and standard. 7 factories that can produce majority of the PPEs locally. So that would mean that it should not be an issue of whether we have enough money or not, because one, you subsidize, you're producing it locally here, and the efforts should be towards funding to ensure that we protect our healthcare workers. So yes, there's a of this and how they're shared. A substantial amount is equally going into paying per diems for people who are doing surveillance, per diems for people who are doing meetings. And the question in last, which is a moral question, is that this situation of a pandemic, should I be paid for sitting in a meeting, or should I let these monies go towards the response and take care of healthcare?
Yeah, go to the actual work that it should be doing instead of just talking about meetings. I mean, we keep discussing this here all the time. Government response and CT, I'm sure you heard this and you were like, okay, here we go again. It has been said, it has been put on paper, it has been announced by the president himself, but before that decision is actualized, to come to the implementation of the basic decisions that are pretty obvious to everybody, it never moves. It's because of all these push and pull, personal interests taking center stage in a time when you're fighting a pandemic. This is something that is threatening your own existence as a human being, and yet we're still having the back and forth fight, City.
The pandemic that we've had for the longest time was the HIV and AIDS pandemic, and I think what we accustomed our healthcare system to was other people taking care of it, or at least predominantly contributing to the taking care of it. Now, this one is smack in our faces. There's no running to any big daddy. Right. It's us and the disease. And yet, it isn't as though we don't have money, we do. But the problems that were once the province of Afya Center, that gave it the tag name
Afya House,
not Afya Center, that gave it the tag Mafia House, seems to have been devolved to the counties, because there seems to be an unbridled greed that does not pay heed whatsoever to anything that would actually help the common man. At least where health, since we're talking health, I'm just referring to health.
Yeah.
It's like someone takes specific care to neglect it.
Deliberately.
Yes. It's like there's effort being made to sabotage and to ensure that the healthcare center doesn't work. Because if money is available and you know what you should do with it, and it continuously doesn't get done, so what are we to conclude?
What is actually, even more worrying, and Dr. Chibanzi, you can still contribute to this as we continue with the conversation, is we are seeing the numbers rising. We are seeing the numbers now across the county rising, and we know that everywhere in the country, people do not, first of all, go to a level 5. No. They will go to the nearest health facility.
Yes.
Right? And if it's a community transmission, that means that nearest health facility, the healthcare worker ought to be protected from that level.
Most certainly.
And then this is where we are seeing that this is not happening. The government has, neglected its bit, abrogated its responsibility, said, we created a Harambee Fund. That Harambee Fund is doing its job. This rich man here has money, has donated money, so those ones are doing well. So the government takes a backseat. What nonsense is this?
You will find that those health facilities, the basic health facilities, will have one genuinely overworked and extended healthcare worker. And if that person should fall sick,
finish.
There are no services being offered.
That's it. That's what it means, Dr. Chibanzi, isn't it?
Yeah, and I don't know if you've seen the tale of that healthcare worker with over 30 years experience in public health in Wajir, who died over the weekend. There was no oxygen.
No.
In
the facility.
I missed that one.
Yeah, so the patient, he over 30 years experience in public health. He was responding to the pandemic as part of the rapid response team. Mm-hmm. He got sick. He required, because he was aged. He wasn't a young healthcare worker. So he was aged. He required treatment. He required oxygen. From that point in Wajir, getting the test result of COVID means it takes a week, because then they have to be flown to Nairobi somehow and brought back to Wajir. And when his disease severity now became worse, his condition worsened, oxygen was required. There was no oxygen available. Even the ambulance to transport him, at least from that level facility to a higher level facility, it was still dysfunctional, and that's the state. So essentially, we lost a healthcare worker who was failed by the system that he is working in. Yeah.
So, and this also will translate to everybody else. I mean, you can imagine if we had an increase in the number of people who are getting infected with COVID, and the government has told us this many times that the people who are highly vulnerable are also likely to be found in the rural areas. That means that their nearest health facility is this level 2, level 3.
Yeah.
So if we get an increased number of people seeking these services and needing these basics like oxygen or like an ambulance to transport them, and they don't get it at these level facilities, then we are going to have a problem on our hands.
Absolutely.
But of interest, I'm sure the good doctor can explain this in greater detail. Right now, we have a fairly good idea of what an extreme COVID case is and what happens before it gets to that. So it isn't as though we're not completely in the dark here. Now, yet, if someone is unwell and you can see the progression, surely any healthcare worker who's worth his weight in salt would understand this is what they need to do. But if the system doesn't have what is required, it doesn't matter how much effort that person actually puts in.
Yeah, it's useless.
Yes.
So, Dr. Now the government, the president is going to be having a conversation with the county governors, in which they're going to have that same conversation again. You know, we are prepared, we are ready to handle this, or we are not prepared because we have not received any money. From where you sit as KMPDU and your own basic projections in the next coming months, looking at the increase in the number of COVID-19 cases, the increase in the number of deaths, what would you, if you were called in into that meeting between the president and the governors, what would you tell them?
Yeah, so the first thing is, let me start with the healthcare workers, because to me they are the central to this response. The recommendations for healthcare workers would basically be on occupational safety and health. One is to make sure that COVID-19 is included in the second schedule of the Occupational Safety and Health Act, because that will now direct compensation. Create an occupational injury and disease fund, which is a proposal we put forth to the Senate ad hoc committee, so that this occupational injury and disease fund will be able to compensate the healthcare workers. Supply of adequate and quality PPEs, that all local manufacturers be subject to the very stringent quality control measures as specified by the Ministry of Health specifications on PPEs and the Kenya Bureau of Standards. So let us have it made public that these are the only ones that can provide and are producing quality PPEs. Then provision of adequate and quality PPEs in all the facilities across the country. The level 3 for the designated COVID-19. Let COVID Fund and Equity Group Foundation supplement the government's effort, and the government equally takes up its responsibility of providing these PPEs. And then thirdly, to reduce the cost of care to Kenyans in the private sector. Waiver of duty and VAT for the testing kits, reagents, personal protective equipment, so that this will reduce the cost of care to Kenyans seeking healthcare in private facilities. Provision of group life for the healthcare workers, and priority testing for all healthcare workers. That has to be done. It's not even a negotiable issue at this point in time. With regards to welfare, ensure that all counties procure the NHIF comprehensive care for all healthcare workers. Counties should timely disburse salaries to their healthcare workers, promote their healthcare workers, and offer psychosocial support, and then employ more healthcare personnel. And the political support to frontline healthcare workers by the political players is to basically adhere to the Ministry of Health guidelines and mitigation measures and prevention of COVID-19. That's from the health workforce perspective. Now, with regards to equipment, oxygen supply in all counties. We already have doctors who've come up with very good proposals on how a fully functional oxygen plant can function in a county. This needs to be considered because it will offer care to Kenyans, not just for COVID, but even in the long term, for anyone who requires oxygen. With regards to the bed capacity, yes, improve our capacity on that, and ensure that each county now has a separate COVID-19 with adequate capacity, to ensure that with that, then now you have people to set them up, and then of course employ more healthcare personnel. So that covers infrastructure, equipment, health workforce, and then budgetary provision for COVID-19 should focus more on the response. That is, to ensure that all the requisite building blocks of the system are in place as opposed to administrative function.
It's obvious to get a lot of these things done, Dr. Chibanzi, is that, somebody ought to be listening and sit up and actually do what is required. Because, we can agitate for it and say quite a number of things over time. But unless somebody actually does take the step, then it would be very difficult to have some of these things done. Your predecessor often said that one of the only ways to get government to listen was to strike. And he said that...
you want the doctors to strike
No. That's not... Wait now, let me finish the statement.
Ignore Eric and
I'm
continue
ignoring
what
Eric.
you're saying.
So he said one of the only ways to get them to understand this was to strike. And I'm asking at this point in time, what would ring a little bit louder in the ears of those who needed to get these things done? Because it's not just the country that's running after COVID now. Medical practitioners are as well.
Yeah, so what used to be said still stays true to that. And I've had these sentiments that you have to be more militant. And you're looking at, yes, we will strike, but that's going to have an effect because it will affect Kenyans, and we don't want to have this situation because the pandemic is actually a crisis already.
Yeah.
That is why we've really restrained ourselves as a union with regards to the issue of going on strike. But when the rubber meets the road, and that's what I was saying in the next 2 weeks, if nothing substantive is done, then that will be the only option. Then perhaps people will now start to address the issue. Yeah.
Perhaps the government will listen.
Yeah.
Dr. Mwachonda Chibanzi, thank you very much for speaking to us, the Secretary General of the Kenya Medical Practitioners, Pharmacists and Dentists Union. We wish you all the best as you continue pushing for this. And of course, let's wait and see what comes out of State House today after that meeting between the President and the governors.
Yeah, thank you very much. And we are hoping that they will come up with the substantive measures.
Asante sana. It's a Situation Room is Kenya's biggest conversation. This conversation continues on Spice FM, broadcasting from Nairobi to Mombasa, Kisumu, Nakuru, Eldoret, Nyeri, Malindi, and worldwide on www.spicefm.co.ke. Also broadcasting on KTN Home